Hi, my name is Dr. Kimberly Cheong, and I'm a pediatrician in the South Bay. Today it's my pleasure to present a webinar on a good night's slumber, tips for healthy sleep habits in children. Before we get started, I'd like to remind you all that you can ask questions on Twitter using the hashtag UCLAMDChat. So sleep is really essential to your child's health. Every living creature, including animals, sleep. And while we don't know yet the exact functions of sleep, we can extrapolate based on animal studies and human sleep deprivation studies. In childhood, we spend a lot of time sleeping. Between the ages 0 to 2, about 9,500 hours are spent in sleep compared to 8,000 hours of wakefulness. And then between ages 2 and 5, the proportions become more 50-50. And in young childhood, about 40% of a child's time is spent sleeping. And this is a really important age for parents and caregivers to instill healthy sleep habits in children, which will benefit them for the rest of their lives. Sleep problems in childhood are very common. Approximately 1 out of 4 children have some sort of sleep issue. Bedtime resistance is seen in 10 to 15% of toddlers. And one study in Rhode Island of 500 elementary school-age children showed that 37% of them had significant sleep problems in at least one sleep domain. Our poor teenagers, 85% of them don't get the minimum required hours of sleep. And when you consider the special needs population, because of various comorbidities and medication side effects, 60 to 70% of them deal with sleep issues. And sleep has really been linked to many, many benefits. They have a restorative benefit where during sleep, proteins are synthesized, your body repairs tissue, and growth hormone is also secreted during the deep sleep that we have, which helps children grow and develop. Sleep has been linked to improved weight control and appetite control as well. While we sleep, the appetite suppressor hormones are actually increased and appetite stimulant hormones are decreased. Sleep is also involved in fighting off infection. One study showed that when sleep-deprived individuals were given the flu vaccine, they produced less than half the number of flu antibodies when compared to well-rested controls who were given the same flu vaccine. Sleep's also been implicated in increased pain tolerance, and inadequate sleep has been linked to diabetes, heart disease, and high blood pressure. Another study of young men who are healthy, they were told to sleep only 4 hours a night for 6 consecutive nights in a row. And when they tested their blood sugar and insulin levels, they were found to be matching pre-diabetic ones. And finally, life expectancy. Many cross-sectional epidemiologic studies have shown that if you sleep 5 hours or less a night, it's linked to an increased risk of mortality from all causes by approximately about 15%. And I think anyone can anecdotally also attest that when we get a good night's sleep, you wake up restored, feeling refreshed, and ready to really take on the day's work. In children, a lot of sleep deprivation studies have shown that lack of sleep contributes to decreased attention, trouble concentrating, and delayed reaction times. Even though the kids might eventually arrive at the correct answer, it takes them a longer time to do so. And that really impairs their ability to do processes that require speed and accuracy. Sleep also is implicated in the executive functioning processes of your brain, which deals with judgment, processing, problem solving, and decision making. And sleep is also very important in memory consolidation. Given all of these important things, it's no surprise that sleep-deprived children tend to perform less well academically. And emotional regulation is also a big part of sleep, where if you don't get enough sleep, you're more likely to feel depressed, irritable, sad, angry. And behavior-wise, a lot of times, lack of sleep is associated with increased outbursts of anger. It might manifest as symptoms of hyperactivity or inattentiveness, and even kind of risk-taking behaviors where you don't really think about the consequences of your actions because you're so tired. It's really a bi-directional, two-way street where sometimes sleep deprivation is actually manifested by attention deficit or hyperactivity symptoms, where a child might be mistakenly diagnosed with ADHD when they actually have sleep deprivation. And on the other hand, a lack of sleep can also worsen any of these related conditions and more. So I would really encourage you to talk to your pediatrician about sleep at every well child checkup. So what actually happens when you fall asleep? There are internal factors such as your internal sleep drive and your circadian rhythms, as well as external factors, meaning the environment, the noise, the level of light, that really are involved in whether or not you are asleep or awake. There is a suprachiasmatic nucleus in the brain and the hypothalamus, which is composed of about 50,000 brain cells. And this nucleus receives information about your surroundings through your eyes and the optic nerve directly. You can think of the SCN as kind of the master's body, the body's master clock, internal clock. It really helps regulate the day-night cycle, and it is thought that as you are awake, and the time goes on, a chemical called adenosine builds up in your body until it reaches a critical mass and you have to fall asleep. Caffeine, which has been called the world's most popular drug, is actually a chemical substance that blocks the action of adenosine and thus promotes alertness. Next, we're going to talk about the types of sleep, which can be divided into non-REM and REM sleep. A non-REM sleep comprises about 75% of a typical person's night, and there used to be 4 stages, but recent guidelines have changed that and kind of classified the old stages 3 and 4 to 1, stage 3. Stage 1 is light sleep, when you're kind of in between that state of wakefulness and sleepiness. You're easily awakened at this point. Your muscles relax with occasional twitches and your eye movements are slow. Stage 2 is a deeper sleep, where you're more disengaged from your surroundings. Your brain waves slow down and you might have occasional bursts of rapid brain waves. Stage 3 sleep occurs soon after you fall asleep and mostly in the first half of the night. This is a very deep restorative sleep where a lot of important bodily functions happen. This is when growth hormone is released, and this is where the majority of the body repair occurs. Usually in this stage, your heart and respiratory rates are slow, your muscles get relaxed, and this is also the stage where in children we see night terrors and confusional arousals. On the other hand, REM sleep is about 25% of your night, and it stands for rapid eye movement sleep. Your eyes move rapidly behind your closed eyelids, your breathing, heart rate, blood pressure become irregular. This is where dreaming occurs, and your arms and leg muscles are temporarily paralyzed. Some people think so that you can't act out your dreams. This graph shows the typical progression of sleep stages through the night for a young adult. If you notice, the first half of the night has a lot of the deep restorative sleep, or stage 3 sleep, and your first REM cycle usually occurs about 70 to 90 minutes after you fall asleep. And each cycle continues throughout the night, with REM sleep increasing more and more, and most of your deep restorative sleep occurs in the first half of the night. REM sleep is also when you dream, and that's where kids can have nightmares. So one of the most typical questions we get asked is, how much sleep does my child need? And as you can see, the number really varies based on how old the child is. But it's important to keep in mind that each child is an individual and their individual needs may vary. But this is a really good guideline. It's a very broad guideline of the recommended sleep duration for each age group. So first we're going to start off with newborns. So in the first couple months of life, a baby's circadian rhythm is not yet established, and sleep patterns are very irregular. They sleep on average about 14 to 17 hours a day, but there are multiple sleep periods during the day and night, lasting anywhere from a few minutes to a couple hours. This also results in parents being very tired and unable to maintain their own sleep regularity. And some people even postulate that postpartum depression is related to lack of sleep in adults. You'll notice a lot of active sleep in newborns, where they're twitching their arms or legs. They might be smiling or sucking. Newborns actually have about 50% of their sleep is REM versus, and it decreases as you get older to 25%. Goals for this age group include SIDS prevention, starting to facilitate nighttime sleep, and creating a positive and safe sleeping environment. So if you have a newborn at home, it's really important to identify signs of sleepiness. This can be manifested as irritability, yawning, rubbing their eyes, and it's important for you to know your child and to watch for these signs. A piece of advice that we often give is to put your baby in the crib when they're drowsy but not yet asleep. This is to allow the baby to self-soothe, to learn to self-soothe and not always need a person beside them to fall asleep. A really important recommendation is to place baby to sleep on his or her back with the face and head clear of blankets and other soft items. There shouldn't be any pillows or stuffed animals in the bed. The mattress should be firm and the crib should be safety approved. These recommendations have really helped to decrease the incidence of SIDS, or sudden infant death syndrome, since the early 90s when they were first implemented. And a quiet and dark room at a comfortable temperature is best for sleep at all ages, and you'll hear that over and over again today. Infants who are up to age 12 months usually sleep 12 to 15 hours. The number of hours that are required decreases, and a more regular sleep pattern emerges at this age. They might start off with 3 to 4 naps, initially at the 3-4 month range, and it'll decrease to 1 to 2 by the end of that first year. Goals at this time are to create regular bedtime schedules and a regular bedtime routine, as well as to decrease nighttime awakenings. Usually by age 6 to 9 months, there is no more need for a nighttime feed. Sleep advice for infants, again, is to develop a regular bedtime schedule that the child enjoys, whether it's a warm bath or you can even start to read together here. It's really important to set aside that time for a bedtime routine. Establish a regular sleep-friendly environment and encourage your baby to fall asleep independently and to become a self-soother. Now we move on to toddlers. Toddlers are 1 to 2 years old, and they sleep 11 to 14 hours a day. By about 18 months, they usually don't need their morning naps anymore, and most of these guys sleep through the night on a regular sleep schedule. Goals at this time are to follow a consistent bedtime routine, again, encourage falling asleep independently, and to transition from a crib to a bed, which usually occurs around age 2 to 3. Toddlers are really growing up fast and starting to assert their independence, which can cause some sleeping issues, especially trouble falling asleep. So it's really important to remain consistent. They're creatures of habit, so they'll appreciate a consistent bedtime routine, and a consistent bedtime environment. It's important to set limits and to communicate the limits to your child and be consistent about enforcing them. A security object can be helpful, such as an old t-shirt of yours or a teddy bear, a blanket, and that can really help toddlers relax. Preschool-age children, age 3 to 5, these guys usually sleep 10 to 13 hours a day, and they usually give up their naps by age 5. This is a time where commonly nighttime fears emerge, and actually sleepwalking and confusional arousals peak at this age group. For your preschool-age child at home, again, it's important to maintain a regular and consistent sleep schedule, follow through with a bedtime routine every night. Your child's room should be kept cool, quiet, dark at night, and we do not recommend a TV in the room. Watch for difficulty breathing, unusual nighttime awakenings, chronic sleep problems, or any behavioral problems during the day. And if you do note those things, please bring them up with your child's pediatrician. School-age children, aged 5 to 12, these guys usually sleep 9 to 11 hours a day. And this is a time where more and more demands are being placed on their schedules. They might start extracurricular activities, sports, they might have homework at school. So again, it's very, very important to prioritize sleep and a bedtime routine. This is also the age where children get interested more in TV, the internet. They might start drinking caffeine and sodas. So it's very important to be mindful and to set limits on how much TV they watch and how much caffeine they drink. TV, especially close to bedtime, has been associated with a lack of desire to go to sleep, difficulty falling asleep, sometimes nightmares and frequent awakenings through the night. So we generally recommend that the screens be put away before bed. For your school-age children at home, again, emphasizing a regular, consistent sleep schedule and bedtime routine, maintaining an environment that's conducive to sleep, avoiding caffeine, and watching for any signs of a medical sleep disorder, which you can bring up with your pediatrician. And finally, our teenagers. Our teenagers usually require 8 to 10 hours of sleep, and they actually experience a biological shift to a later sleep-wake cycle, actually about 2 hours later than what they were doing in earlier childhood. So it's not their fault if they want to go to bed late and sleep in. About 55% of sleep-related car crashes involve drivers 25 years of age or younger, so it's really a public health issue. And shortened sleep impairs learning, performance, safety, and health during this very important time between childhood and adulthood. For your teenagers, we recommend maintaining a regular schedule, including on the weekends. Try to wake up at the same time each morning, and if you do sleep in, don't make it longer than 1 to 2 hours. Avoid caffeine, tobacco. Nicotine is a stimulant as well as caffeine, so it's very important to avoid any sleep disruption. We recommend not driving when sleep deprived. Rolling down your windows or drinking caffeine, those aren't good substitutes for actual sleep or a nap. And consider a media curfew. Try to put those tablets, TVs, and computers away half an hour to an hour before bed. The American Academy of Pediatrics actually put forth a policy statement in 2014 recommending later school start times to 8:30 in the morning or later. Several studies done in the US have shown that with late start times, kids actually do get more sleep. They don't just stay up later, and their mood improves, even academic performance and number of car crashes in the area improves. So if you are a parent of a high school child, we can recommend you to advocate on their behalf to your schools to consider a later start time. So in summary, establishing a regular sleep-wake cycle is important in childhood. Follow a 20 to 30-minute relaxing bedtime routine. This should really be prioritized, and you have to make time in your schedule for it, or else it won't happen. The bedroom should be kept quiet, dark, and cool. If you need the dark curtains over the windows because your child's sleep is interrupted in the mornings, that's also a great way to facilitate a good environment. Do quiet activities that are more conducive to sleep before bed. Exercising daily will help kids fall asleep at night, as long as you don't do it too late in the day. And a healthy diet is just so important for children to grow and develop well. A nighttime snack would be maybe a glass of milk or some fruit, something healthy and not too heavy. And children should nap according to their age and sleep needs. So before I end, I'd like to answer a few commonly asked questions. The first one is, can I repay a sleep debt by sleeping in over the weekend? So in the short term, you probably actually can. If your child stays up late one night studying for an exam and then gets extra sleep for the next couple of nights, then they probably can repay a sleep debt. But there's no way to repay a prolonged sleep debt for a prolonged period of time. And you're experiencing the negative effects of being tired, exhausted, irritable, and having delayed reaction times that might actually cause accidents. So we really recommend you to really keep a consistent bedtime and wake-up time every day. Also, if you do get into the habit of sleeping less during the weekdays and then sleeping in on the weekends, you set yourself up for a vicious cycle, since on Sunday night you probably won't be tired enough to go to bed at a decent time. The second question is, my 5-month-old now rolls over onto her stomach when she sleeps. What should I do? So we definitely don't expect all our families to be keeping a vigilant watch over their 4 or 5-month-old babies while they sleep. The AAP's recommendation is to put babies to bed, at least initially, on their backs until they're 1 year of age. And if the baby rolls over on their own while sleeping, then you should just leave them as is. Make sure there's no other pillows, blankets, stuffed animals in the crib. And finally, should I give my child melatonin to help with sleep? So melatonin is a hormone produced by the pineal gland in the brain. And in animals that sleep at night, the melatonin acts as a signal to kind of shut down and sleep. Studies have shown that sometimes autistic children have a deficiency in melatonin, and supplementing them can help them if they have sleep trouble. But in general, it's best to give your child melatonin with your pediatrician involved to make sure that it's the appropriate medication for them. And melatonin is generally safe, especially when used for short periods of time. And it's a medicine that usually helps with sleep onset issues. Some of the side effects might include nightmares and night awakenings. So if you do give your child melatonin, please consult your doctor first. So that concludes my talk. Thank you so much for watching, and I'd like to remind you to ask questions on Twitter using the hashtag UCLAMDChat.